Many people over the age of 60 believe that nerve pain is simply a permanent part of getting older, something they must accept and endure for the rest of their lives. But this belief is often incorrect and unnecessarily discouraging. In reality, one of the most common reasons nerve pain appears or worsens with age is not irreversible damage, but hidden vitamin deficiencies that quietly develop over time. As the body ages, the digestive system becomes less efficient, stomach acid levels decline, and the absorption of key nutrients drops significantly. This means that even if someone eats a reasonably balanced diet, their nerves may still be deprived of essential vitamins needed to stay healthy and function properly. Nerves are living tissues that rely on a constant supply of specific nutrients to maintain their structure, protect their outer insulation, and transmit signals accurately between the brain and the rest of the body. When those nutrients are missing, nerves begin to malfunction, leading to symptoms like burning, tingling, numbness, weakness, and sharp electric-like pain. What makes this situation more concerning is that vitamin deficiencies often go unnoticed for years. The symptoms may start mildly, perhaps as occasional tingling in the feet or a slight loss of balance, and slowly progress until daily activities become uncomfortable or even frightening. Doctors sometimes label this as age-related neuropathy, giving the impression that nothing can be done, when in fact the nerves may be sending out clear signals that they are undernourished. Deficiencies in vitamins such as B12, B1, B6 and D are extremely common in older adults, especially those who take long-term medications for blood sugar, blood pressure, stomach acid or heart conditions. These medications, while necessary, can interfere with how vitamins are absorbed or utilized in the body, further increasing the risk of nerve-related problems. The encouraging truth is that nerves respond surprisingly well when their nutritional needs are finally met. In many cases, what feels like permanent damage is actually a state of chronic irritation and malfunction caused by a lack of essential vitamins. When these deficiencies are corrected consistently, inflammation around the nerves can decrease, nerve signaling can stabilize, and the protective layers around nerve fibers can begin to strengthen again. This does not mean that every case of nerve pain will disappear overnight, but it does mean that improvement is often possible even after years of discomfort. Many older adults report that once they address these deficiencies, the intensity of pain lessens, sensation improves, and daily movement becomes easier and safer. Understanding that nerve pain after 60 is often linked to vitamin deficiencies rather than permanent damage can completely change a person's outlook. Instead of feeling helpless or resigned to pain, they can take an active role in supporting their nerve health. This shift in perspective alone can be empowering because it replaces fear with possibility and gives the body a chance to heal in ways that were never previously supported. As the body grows older, one of the quiet changes that takes place is a gradual decline in how efficiently nutrients are absorbed and used, and this has a direct impact on nerve health. After the age of 60, digestion is no longer as strong as it once was, stomach acid production decreases, and the delicate balance of enzymes needed to break down food becomes less reliable. These changes may not cause obvious digestive symptoms, but they significantly reduce the body's ability to extract essential vitamins from even the healthiest meals. Nerves are particularly vulnerable to this decline because they depend on a steady and adequate supply of specific nutrients to maintain their structure, protect their outer coverings, and transmit signals smoothly. When absorption weakens, nerves can begin to suffer quietly long before blood tests or outward signs reveal a problem. Another important factor is that aging bodies tend to store fewer vitamins than they did in earlier years. The liver and other tissues that once acted as reliable nutrient reserves become less efficient, meaning deficiencies can develop more quickly and progress faster. This is why someone over 60 may feel fine for years and then suddenly notice numbness, tingling, weakness, or burning pain in their hands or feet. The nerves have been slowly deprived of what they need, and eventually they reach a point where they can no longer compensate. This starvation does not destroy the nerves immediately, but it does make them irritable, inflamed, and prone to misfiring signals that the brain interprets as pain or discomfort. Long-term medication use also plays a major role in this process. Many common prescriptions taken by older adults, such as those for blood sugar control, blood pressure, cholesterol, and acid reflux, interfere with how vitamins are absorbed or activated in the body. Over time, this creates a perfect storm where nutrient intake may appear adequate on paper, but the nerves themselves are not receiving or using these nutrients effectively. This hidden deprivation is especially damaging to nerve tissue because nerves have limited ability to regenerate compared to other cells, making them more sensitive to even mild, ongoing deficiencies. When nerves are starved of essential vitamins, they lose the materials required to repair daily wear and tear, the protective myelin layer can thin, communication between nerve cells can slow, and energy production inside nerve fibers can drop. This leads to symptoms that feel progressive and alarming, such as worsening pain, loss of balance, muscle weakness, and increased sensitivity to temperature or touch. Many people assume these changes are irreversible, but in many cases, the nerves are still alive and capable of recovery if they are properly nourished again. Restoring adequate vitamin levels can begin to reverse this starvation process. When the body finally receives and absorbs the nutrients it has been missing, inflammation can ease, nerve signaling can stabilize, and the repair mechanisms that have been struggling for years can start working again. This does not mean aging is reversed, but it does mean that many of its most uncomfortable effects on the nerves can be softened, slowed, or even partially improved, allowing older adults to regain comfort, confidence, and a sense of control over their physical well-being. Vitamin B12 plays a central role in keeping the nervous system healthy, and its importance becomes even greater after the age of 60, when deficiencies become far more common. This vitamin is essential for maintaining the myelin sheath, the protective layer that wraps around nerve fibers and allows messages to travel quickly and accurately from the brain to the body. When B12 levels are low, this protective layer begins to weaken and nerve signals start to misfire. This is often experienced as tingling, numbness, burning sensations, or a strange electric feeling in the hands and feet that can gradually spread upward over time. Many people assume these sensations are simply part of aging, without realizing that a lack of vitamin B12 may be at the core of the problem. As people get older, their ability to absorb vitamin B12 from food declines significantly. This happens because the stomach produces less acid and intrinsic factor, both of which are necessary for proper B12 absorption. Even individuals who eat meat, eggs, and dairy regularly can still become deficient. Certain medications commonly used by older adults, such as acid blockers, diabetes drugs, and some heart medications, further interfere with absorption, making deficiency even more likely. What makes this especially challenging is that standard blood tests can sometimes show levels that appear normal, even when nerve tissue itself is not receiving enough B12 to function properly. When nerve cells are deprived of vitamin B12, their ability to repair damage is reduced and inflammation around the nerves can increase. This leads to a gradual worsening of symptoms that may include balance problems, muscle weakness, memory issues, and persistent nerve pain. Over time, untreated deficiency can contribute to more serious nerve damage that becomes harder to reverse. However, when vitamin B12 is replenished in the right form and taken consistently, many people experience noticeable improvements. Tingling may decrease, burning sensations can calm, and overall nerve sensitivity may begin to normalize as the protective myelin layer starts to strengthen again. Another important aspect of vitamin B12 is its role in energy production within nerve cells. Nerves require a tremendous amount of energy to transmit signals and maintain their structure. Without adequate B12, this energy production slows down, leaving nerves fatigued and less responsive. Restoring B12 levels helps reactivate these processes, allowing nerve cells to function more efficiently and respond better to repair signals. This is one reason some individuals report feeling clearer, steadier, and more physically capable after addressing a long-standing deficiency. Understanding the connection between vitamin B12 and nerve health can be empowering, especially for older adults who have been living with unexplained nerve symptoms for years. Recognizing that these sensations may be linked to a correctable deficiency rather than permanent damage opens the door to meaningful improvement. When vitamin B12 is included as part of a consistent daily routine, it supports nerve protection, encourages repair, and helps restore smoother communication between the brain and the body, giving the nervous system a stronger foundation to function as comfortably as possible again. One of the main reasons vitamin B12 deficiency is so widespread among older adults is the natural decline in stomach acid, an intrinsic factor that occurs with aging. These two components are absolutely necessary for extracting vitamin B12 from food and transporting it safely into the bloodstream. When stomach acid is low, B12 remains bound to food proteins and simply passes through the digestive system without being absorbed. Intrinsic factor, a compound produced in the stomach lining, is equally important because it escorts B12 through the intestines for absorption. After the age of 60, many people produce much less of both, which means even a nutrient-rich diet may fail to meet the needs of the nervous system. On top of this natural decline, millions of seniors take medications that further reduce B12 absorption. Acid-reducing drugs used for heartburn, reflux, or ulcers are among the biggest contributors. These medications lower stomach acid even more, making it extremely difficult for the body to release B12 from food. Diabetes medications like metformin interfere with B12 uptake in the intestines, while some blood pressure and heart medications alter nutrient transport over time. These drugs are often taken daily for years, sometimes decades, quietly draining vitamin B12 reserves without obvious warning signs. The deficiency develops slowly, which is why many people do not connect their nerve symptoms to a vitamin problem. What makes this situation especially tricky is that B12 deficiency does not always show up clearly in routine blood tests. Blood levels may appear borderline or even normal, while nerve tissue itself is starving. Nerves require a constant local supply of B12 to maintain their protective coating and energy metabolism. And blood measurements do not always reflect what is happening inside nerve cells. As a result, people may be told their labs are fine while they continue to experience worsening numbness, burning pain, balance issues, or weakness. Because of these absorption challenges, the form of vitamin B12 becomes critically important for older adults. Active, bioavailable forms are much easier for the body to use and do not rely as heavily on stomach acid for absorption. When these forms are taken consistently, they can bypass many of the age-related barriers and deliver B12 directly to where it is needed. This can help restore nerve function more effectively than relying on food sources alone. Over time, replenishing vitamin B12 levels can help stabilize nerve signaling, strengthen the protective myelin layer, and reduce irritation that causes pain and tingling. Many seniors notice gradual but meaningful improvements when they finally address this hidden deficiency properly. Understanding that low stomach acid and common medications are often the real culprits behind B12 deficiency allows older adults to take targeted action, support their nervous system more effectively, and avoid unnecessary suffering caused by a problem that is far more common and treatable than most people realize. Vitamin B1, also known as thiamine, plays a deeply important role in nerve health, yet it is one of the most overlooked nutrients when it comes to aging and neuropathy. Nerves require enormous amounts of energy to function properly because they are constantly transmitting signals between the brain and the rest of the body. Vitamin B1 is central to this process because it helps convert glucose into usable energy inside nerve cells. When B1 levels are low, nerve cells become energetically weak, slow to respond, and more vulnerable to damage. This lack of energy does not kill nerves immediately, but it causes them to struggle, misfire, and send distorted signals that the brain interprets as pain, burning, tingling, or numbness. After the age of 60, vitamin B1 deficiency becomes increasingly common for several reasons. Aging affects how efficiently nutrients are absorbed and stored, and thiamine reserves in the body are naturally limited. Conditions such as diabetes, which is strongly linked to nerve damage, rapidly deplete vitamin B1 because high blood sugar increases its loss through urine. Long-term stress, alcohol consumption, and certain medications also reduce thiamine availability. Over time, this creates a silent deficiency that gradually weakens nerve tissue, especially in the legs and feet where circulation is already reduced. When nerves lack adequate vitamin B1, their ability to send clear electrical signals deteriorates. This can result in delayed nerve responses, poor muscle coordination, and increased sensitivity to pain. Many people with neuropathy notice that their symptoms worsen after meals or during periods of blood sugar fluctuation, and this is not a coincidence. Vitamin B1 helps nerves manage glucose effectively, and without it, spikes and drops in blood sugar place additional stress on already weakened nerve fibers. This makes pain more intense and recovery much slower. There is a form of vitamin B1 called benfotiamine that is especially beneficial for nerve health. Unlike standard thiamine, benfotiamine is fat-soluble, allowing it to be absorbed more efficiently and reach nerve tissue more effectively. This is particularly helpful for older adults and individuals with diabetes, whose digestive systems may struggle with water-soluble forms. When benfotiamine is taken consistently, it supports energy production inside nerve cells, reduces harmful byproducts created by excess glucose, and helps calm irritated nerve pathways. Over time, restoring adequate vitamin B1 levels can help nerves regain stability and resilience. Energy production improves, inflammation decreases, and the frequency of pain signals can begin to drop. Many people report that sharp, shooting pains soften, balance improves, and daily movement feels more controlled once their nerves are no longer operating in an energy-deprived state. Understanding the role of vitamin B1 shifts the conversation away from accepting nerve pain as permanent and toward recognizing it as a condition that can often be supported and improved when the nervous system is finally given the fuel it needs to function more normally again.